Hi everybody, it's Dr. Bingham here at Compass Chiropractic, and I've got Aaron helping me with some plantar fasciitis information that we're putting out for anybody who's interested. A lot of people suffer from this condition. As I mentioned in the previous videos, we're not going to go through and describe it, but we did already earlier up in the blog post here. We have a informational sheet that also describes this condition that you can download from the website. Feel free to pass that out to anybody else that's suffering from this condition. As you may have noticed, when we treat plantar fasciitis, we're not looking just at the foot. You know, like I used the analogy in one of the other videos about if you had a problem with your tire, if you went out and you saw a tire issue, you were wearing down your tire more on one side than the other, you wouldn't think that you solely had a tire problem. You'd know, like, well, there's something else that's causing this. And the same thing happens with plantar fasciitis. Typically, you know, we're getting pain in the heel and some pain that radiates out into the foot. That's important to address that area, but we've also got to figure out why. The big question is, why is this happening? A lot of times it's due to hypertonicity in some of the soft tissues. So today we're going to be using a tool called the Fusion. It looks a lot scarier than it is. What it is for today's purposes, we're going to be using this metal edge right through here. Now the reason we do this as opposed to using our hands is because we're going to be working on the fascia in a couple different areas. One is the fascia that runs on the underside of the foot. This is an area that gets a lot of strain as we step down. It can develop adhesions, and that fascia, which is kind of like a thin band of tendinous material, gets these adhesions, and then it can't function properly, and that's when we end up with inflammation, which is the plantar fasciitis part of what a patient might be experiencing. So to treat this, we use the round edge, or the sharp edge of this. We come in through here. Now the place that I'm going to begin is closer to the heel, and then I'm going to work my way out. Now I start off pretty light. It might be a little bit ticklish, but I can feel when I get here that there's some, almost like a kind of a scraping sort of feeling that tells me that that's one area that we've got some adhesions. Now the nice thing about the tool, it gives me some feedback, because as I go over that, because it's metal, it's going to give me feedback as far as the resonance of the tissue. And we've got a little bit towards the middle, but really we're kind of middle, and to the outside is where I'm feeling some of that resonance. So I'm gonna start off pretty slowly with this, and I'm gonna work up to adding more and more pressure because we want to get some blood flow into the area. We don't want to immediately get in here and start digging into this because it can be pretty sensitive, particularly if someone's got an active case of plantar fasciitis. So as we go through here, one of the things that we can check, we can see, all right, well, how's Aaron's dorsiflexion, which is this motion right here. And we can drop this back down. Typically we'll compare this side to side. I'm going to be looking to see if there's any type of restrictions there. Does it feel like he's having a problem through here? I'm going to look at the joints like we did in the other video. If we see this, we can go back and we can retest this after we've gone through and done some of these therapies and see, have we improved some of the dorsiflexion? And when I use that term, that's, like I said, bringing the toes up towards the shin. Now this is one part of the therapy. We typically would go through and do this for probably about 5 to 7 minutes. We don't want to do it for too long because we can get a lot of inflammation here. And I'm going to have Aaron, following this, get his water bottle that's an ice bottle, and have him roll over that to make sure we keep that inflammation down. Inflammation is a good thing, but too much of it can be a bad thing. So now the other area that we're going to be addressing are going to be the muscles on the back of the leg. So for that, I'm going to have Aaron flip all the way over. And first thing we do, we palpate, get an idea where some of the tension is, and then we can use the tool to guide us. And we're looking for the same thing here. We're looking for those kind of rough areas where we almost get this sort of bounciness over the tissues, and that's where we know we've got these little adhesions that run through the fascia. Now, if I find a spot that's particularly tight, I can get in here and work a little bit deeper. But in the beginning, primarily, I'm going to work kind of like I did on the base of the foot there. I'm going to work to get the area mobilized, get some more blood flow in there, before I really get in here and start digging into some of these spots here. Now, primarily right now I'm over the muscle belly. I'm also going to want to get down here and see how are the tendons doing, and And this is where it can become a little bit more sensitive, and I've asked for feedback. I want Aaron to tell me, is this 5 out of 10, 6 out of 10? Are we getting to the point that this is uncomfortable, that he's up there gritting his teeth? That's something we don't want. So we would use this once again for about 5 to 7 minutes, loosen up the tissues, and from there we'd go back, do that same test, retest his dorsiflexion, see if we've seen some improvement through here. Once again, from here we're going to give him exercises to do to maintain that dorsiflexion and maintain that the length of the tissues through the back of the leg here. So this is one way that we would use the fusion tool to help lengthen, open up some of the tension on the back of the leg. The reason that this is important, and I didn't explain this at the beginning of the video, if we've got tight muscles pulling up here, what this does is it pulls up on your Achilles tendon, which goes into your heel bone. What that does is it stretches out that plantar fasciitis, or that plantar fascia, causing pain at the origin, also along into the insertion of the plantar fascia. So if we can loosen up the muscles through here, it's going to take the tension off of this tendon that goes down into the heel. We may also see that the reason he's tight through his calf is because there's some issues going on in the hamstrings, the glutes, all the way up into the low back. We're not going to address that completely here in the video, but just to give you an idea of some of the things that we would use to treat plantar fasciitis and some of the options that you might have if you're suffering from something like this. All right, thanks for watching.